Hey, I'm a psychiatrist, and I've seen this happen quite a few times. And this is when someone gets told they have ADHD and they start treatment. They feel a little better, but then they continue to struggle with symptoms that just don't seem to fit. Or when a kid gets an autism diagnosis and the parents are like, okay, but what about all this other stuff that's still very much there? You see, here's what nobody tells people up front, and that is ADHD and autism share symptoms that can look almost identical on the surface, and missing this overlap can really derail someone's entire treatment plan. So today I'm going to break down one huge diagnostic overlap termed social difficulties and how to identify the root cause in both conditions. If you're new here, my name is Dr. J and I'm a psychiatrist with one goal, and that is to make mental health make sense for you. So, social difficulties comes up a ton in psychiatry, and it's one of the few diagnostic points that creates the most confusion in diagnosis and treatment of various psychiatric conditions. ADHD and autism specifically can make social situations genuinely distressing, but for completely different reasons. Now, instead of explaining complex mental health jargon, let's walk through a scenario to drive this home. I want you to picture a 10-year-old at a birthday party. There's cake, there's games, there's a bunch of kids running around, but this child is standing off to the side, not really engaging with anyone. You see, to an outside observer, it looks like they're struggling socially, which is a fair observation, to be honest. But where it gets interesting is the reason behind the struggle. This tells us everything. If this child has autism, what's happening in their brain is fundamentally about understanding social cues and the mental states of others. This concept is called theory of mind, and don't let the fancy term throw you off. It just means the ability to recognize that other people have their own thoughts, feelings, and perspectives that are different from yours. You see, for autistic individuals, this doesn't come automatically. They might not pick up on the subtle facial expressions that tell you someone's getting bored, or the shift in tone that means a joke just landed wrong. Think about it this way. Their everyday social challenges feel like trying to read a book in a language they never fully understood. On the other hand, if the same child has ADHD, the social difficulty comes from a completely different place. Remember the concept of theory of mind? It's generally fine in this case. Folks with ADHD can read the room, they know what other people are thinking and feeling. The problem is more about impulse control and attention regulation. So they might interrupt someone mid-sentence. This is not because they can't tell that the person was talking, but it's because the thought in their head felt so urgent that they could not hold it back. Or they might zone out during a conversation and miss a bunch of important context, but then later jump back in by saying something that does not fit the conversation at all. So the social challenge for someone with ADHD come from an executive function struggle, not from difficulty understanding social mechanics and norms. This distinction really matters because for the autistic child, what helps is explicit teaching of social skills. For example, breaking down that certain expressions mean certain things, practicing back and forth conversations, and learning the rules that others pick up intuitively. On the other hand, for the child with ADHD, what helps is managing the impulsivity and attention, which might mean trying medications or behavioral strategies or environmental supports that reduce various distractions. Now, here is where it gets way more complicated. When someone has both ADHD and autism, which guess what? Happens about 50 to 70% of autistic individuals, the social difficulties can compound. See, now they're dealing with both the theory of mind challenges and the executive function struggles, which means they need support for both. And that's exactly what gets missed when we only look at one diagnosis. The bottom line is this: if you see someone struggling socially, you can't just slap a label on it and call it done. I know this is a psychiatrist and a lot of medical doctors feel the same way. You have to ask, what's driving this? Is it understanding? Is it impulse control? Or is it both in the case of ADHD and autism? Now, whether you're a parent, a teacher, a friend, or someone who's wondering about yourself or someone else, here is one major action step, and that is if you or someone you care about has been diagnosed with ADHD or autism, but things still don't quite add up or feel right. For example, there are still many symptoms that are not responding to treatment, or there are struggles that don't quite fit the typical pattern of their diagnosis. Definitely bring this up with your licensed medical provider, including maybe considering a comprehensive assessment. You can specifically ask about co-occurring conditions and really try your best to engage the provider in deep and hopefully enlightening discussions about the evaluations and the results. Now, if the video made sense to you, then you'd want to watch this video right here that goes into another extremely important overlapping symptom in ADHD and autism and how to tell them apart. Don't forget to subscribe to this channel and share this video with people who you care about. I read and respond to every single comment, so share one thing that this video brought to mind for you, and I promise I'll respond. Your insights really does help shape future videos. Meantime, I'm Dr. J, and this is Mental Wealth ND. I'll see you in the next video. Peace.